Good morning. I'm Casey Childers from the Shaw Cancer Center. We're here at our beautiful Dillon location to introduce Dr. Erin Schwab to the team. She's our newest medical oncologist with the Shaw Cancer Center. Erin, would you mind telling us a little bit about yourself?
Thank you so much for that introduction. Yeah, my name is Erin Schwab. I'm the new medical oncologist. I've been here for about a year now, right when the center opened. And I come from Michigan. I was within another practice there at that time. But just to give you a little background of my training, I did residency in Chicago at Loyola University. And then I ended up in beautiful Sacramento for my medical oncology and hematology fellowship. I spent a few years there, loved the outdoors there, and then ended up in Michigan and found that I was kind of missing the outdoors.
Well, thank you so much for joining us, Erin. Could you tell us a little bit about why you chose oncology out of all the other options?
Sure, yeah. So I got into medicine truly to help people, and I feel like cancer is one of those fields where you really do have the greatest impact on helping people. Cancer has this connotation of the big C associated with it, and I've noticed this throughout my career so far as an oncologist, and I like to try to calm those fears. I love to create these really deep relationships with my patients and really help them through this very difficult time in their life. Many people are living with the diagnosis of cancer for many, many years, if not cured, and I think that is the one great thing about working in cancer is that I can actually cure people, where many other fields of medicine I can't cure people. And with that comes these really deep relationships with patients, long-term relationships. I see these people for years and years and years. And this is really what drew me into treating patients in oncology over any other field of medicine. It's truly a passion.
Why did you choose Dillon? Why Summit County?
Sure. I'll start with a little background. So when I was in medical school, it was my first year of medical school. It was 2008. My husband, he was my boyfriend at the time, decided to take a trip to Aspen to go skiing. And on the way up there, we drove through this cute little town, Dillon, and we stopped at a restaurant. And I remember sitting at this restaurant, which was the Dillon Dam Brewery, still here today. And we were sitting there, and I just remember saying to him, wouldn't it be great to be the doctor in a town like this? You have all the mountains and all the outdoor activities. And I think that's one of the biggest draws that I've had for coming here. And to have the opportunity to head up a new cancer center here is just, it's been an amazing opportunity. I haven't been happier. I have skiing right outside my back door, cross country, downhill. I've got, I do trail runs literally across the street from here. I wanted to also raise my kids in an environment that was active. And just so you know, I have 3 boys, all under the age of 5. So I'm a busy mom. And I wanted them to live in an environment where they're active and not just sitting in front of a TV. And I think that I've been able to accomplish that by coming here and serving this community.
So Dr. Schwab, we talked about coming to you today from the Dillon Health Center. Prior to you joining the team, we had only limited services in Summit County at a small clinic with just minimal services again. Can you tell us about what makes the Dillon Health Center and Shaw Cancer Center so special here in Summit County?
Yeah, as we're building, we are getting so many new services available for patients. We currently have the breast imaging center, which is great. Patients can get their mammograms done as well as get biopsies if there's some abnormal mammograms and can get it done right here on site instead of having to go over to Edwards. At our Shaw Cancer Center here, we actually have all the capabilities as the one in Edwards. We're able to do infusions as well as provide additional support. And I have an amazing staff I have to speak to. I have a clinical nurse as well as we have great navigation and infusion nurses. I have an amazing staff with a full phlebotomy team. We also have a social worker who's on site here to support our patients with opportunities for group settings for patients to meet and greet each other as they're going through these difficult times. We also have a nutritionist on site and as well as some additional support services that really embody the Shaw experience, including things like we have an acupuncturist as well as a massage therapist that come and provide support for our patients. And I really think that we're able to provide everything that Edwards has to offer here in Dillon, which I think is an amazing, it's amazing that we have this facility here, and I'm actually very honored to be heading this up.
I really love how you've taken the approach of holistic, comprehensive care here. We talk about the state-of-the-art technology, the beautiful facility we have, the fantastic staff, it really is a testament to that full body care that we provide to our patients, with everything, again, from the facility to the beautiful scenery, the breathtaking altitude, all those great things. That's what is, I think, really unique about the Dillon Health Center as this extension of the Shaw Cancer Center. So thank you so much for joining us today. We'd really like to invite all the patients in the local community. If you have any questions, please give us a call. Feel free to stop by our website at shawcancercenter.org or stop on by and meet Dr. Schwab in person. We'd be happy to have you.
I would definitely be happy to see you. And thank you so much, Casey.
Yeah, thank you.